Oh, there it is. Are we live, everybody? All right, what's going on, everyone? Setting up all these lives with my team here. So excited. So, all right, here we go. This is the live event for Testosteronology. Ask the Testosteronologist. My name is Dr. Thomas O'Connor. I'm the first testosteronologist, but we have a bunch of testosteronologists that are in training from the Testosteronology Society to service all you members at the Testosteronology Health Portal, where you can get your answers to anything related to testosterone and anabolic steroids, of course, harm reduction, just really trying to protect all you guys, as I've been doing this for how many years? I mean, 20 something years. So I want you guys to understand how I do it, right? So these are live events and free events. So I'm here to answer as many questions as I can. I'm really the first doctor in the world that's a real internal medicine doctor, academic guy, but also a guy that has been involved in this. And I'm 62, and my heart and my kidneys are protected, and I want to preserve and share that. I want to preserve health for everyone. So again, I'm not putting down gurus and health coaches and all these guys too much, but there has to be a line. There has to be now. I have to buttress myself and put my foot in the sand and say, that's enough now. So if you're on testosterone and you're at a clinic and it's good and they're helping you, but you're not that happy, or they don't know everything like we do, you have to get your questions with us. So again, and this is just what guys, for all you guys who don't know me, you can see I've been around for a long time, taking care of a lot of pro bodybuilders, powerlifters, and strongmen, and doing the best I can. I'm trying to, and a lot of the guys, despite even what I've tried to do, they end up with heart disease and kidney disease. I'm not kidding. I mean, that happens to people as they get older anyway. And then if you're on steroids or too much testosterone, this is a nightmare. Again, the world of testosterone's open up. I love that. I'm very happy. I always want to keep kids off steroids, but let's get going. That's my spiel. And again, you want to go to testosteronology.com and you want to see everything that we've developed. This has been for years and years and years, and now we have doctors and nurse practitioners working and giving you legitimate health-related information. This is legitimate evidence-based internal medicine. It's not anti-aging and all this kind of shit. This is real, super hardcore, yet complex, yet conservative internal medicine for people that are on testosterone. Now, my presentation together today, because I'm always going to give a little snippet for free. So the 5 top medical errors, the 5 top medical mistakes that I see in the world of testosterone, TRT, and of course, bridging over to the utilization of steroids, because if you're on steroids, you're on testosterone. Okay, and it's just a dose-dependent phenomenon, right? What's the difference? People always say, even good doctors ask me, Doc, what is the difference between testosterone and a steroid? They're both controlled drugs. I don't understand this. Well, testosterone theoretically is for replacement for men, and women need it too, but that's really off-label use for women, off-label, but we all agree women need it. But again, these are the guidelines that I'm developing with other experts in the world that are real, not like wellness and anti-aging. That's just not real, guys. It's not real. So this is understanding how to protect yourself as you live in the best quality of life on androgens. So when you really look at the data, there's no data for a lot of this stuff using aromatase inhibitors and all these things. So let's go into what I've seen over 20 plus years, what the medical mistakes are. Let's start down at the bottom. Medical mistake number 5, using aromatase inhibitors. I'm going to keep it down to 5. It's not even number 1, right? So, and I think about this stuff all the time, right? So aromatase inhibitors are, and I always want you guys to fact check everything I say, but just do it with legitimate means. You know, an AI can be legitimate, but it's like, go to a real doctor but hold on. Maybe if a doctor doesn't know it, you can go to your guru or coach. And I am pushing coaches. Come stand on a stage with me. You want to come up and try to argue me on some of the cardiovascular, modalities and how steroids and testosterone can affect the heart and kidney? Let's serve it up, man. Serve it up. So number 5, aromatase inhibitors. You go to a clinic. This is notorious now. And there's no data for this, and it's just anecdotally crazy now. You start on too much testosterone, and then you just block the estrogen with the aromatase inhibitors. Aromatase inhibitors are, say, inositol, the number 1, right? This is a drug, and fact-checked all this. It's a drug that has been over decades produced for women. 99% of breast cancer is women, 1% men. Check that out. So they use these drugs, and they still use them, but they don't use them to, like, let's balance the estrogen. They use it to save lives, because the woman's going to have another breast cancer from one breast to another. It's called metastatic breast cancer. So, and they don't feel good when they're crushing their estrogen, but they have no choice because they're going to die. Now, those medicines are very powerful, and it's amazing how they made it into the world of anti-aging and wellness, but there's no indication, and we can use things off-label, but it's just notorious that these clinics and in the streets and bodybuilders have developed these protocols to use these different aromatase inhibitors at day 2, day 4, it's just, and you look at this number on paper for estrogen, that's a medical mistake, brother. Serve it up, because there's no way you don't do it like, and estrogen has been proven to be brain effective, CNS protective, cardiovascularly protective. But the way you get around not using an AI is you microdose. You don't take too much estrogenic testosterone. Keep it to a down low. And what is the estrogen doing? Are you moody? Work around it. Work on your doses. Don't take 200 milligrams a week and just give the AI. It doesn't, I have to yell and scream. It doesn't make sense. I want someone to try to argue. I want someone to argue me. I want it. Number 4, over phlebotomizing. So many videos on this for so many years. I made the ABCDs, A1C, blood pressure, cholesterol. You know those are going to be coming up as we go towards number 1, guys. So when we look at this is my D. The D is iron deposition or iron depletion disease. I want you to really this is where it's beyond the health coaching guru. This is a deep dive into hematology, understanding the paleontology or the anthropology of the hemoglobin moiety. Isn't that funny? Hemoglobin. It's a mammal thing. You understand in humans that when you look at the development of this over I almost said decades, that would be crazy. I'm so used to saying that. You're talking thousands of years. Okay. Now you look at humans. There's 3 types of mutations of what's happened with the paleontology of people. You have Northern European people, right? And you have people that are. This is when you look at Northern European ancestry and hereditary hemochromatosis. This is a deep dive. Then you have sickle cell and carrying state, then thalassemias. We're done. That covers the whole world, okay? From Europe to Asia to the continent of Africa, throughout that itself over to North America, Central, South America, Asia, Russia. I'm done. Okay, and in the poles, right, in Iceland and all this, the European people. Look, when you take androgens, it's going to affect the erythrocytosis. But most of these clinics and guys in the underground and streets, they think that when you produce X amount and your hemoglobin goes up, say to 17.4 and your hematocrit is like 52.3, got to dump blood. And then the doctors, these poor doctors don't know anything. It's sad for them. I think it's just embarrassing because we're supposed to be smart guys. And it's an embarrassment and it's a tragedy and a paradox that the bro guys know more than the doctors. But that's coming to an end with me and testosteronology. Because over 20 years, I've brought those together. Steroid world, meet traditional medicine. Hi, nice to meet you, sir. Okay, so when you're over phlebotomizing, you're not understanding the pathophysiology. Your erythrocytosis is too much? What's the line in the sand? Is it 18 grams per deciliter for hemoglobin? Is it 17? What's your risk? Have you had blood clots? Have you had pulmonary embolism, strokes, heart attacks? Have you checked for some of those things? Do you have thick blood in the family? I'm telling you guys, this is why I created this. It seems over the top, but you could learn it yourself. You can go on this health portal and learn this. We've been developing this for over 20 years. Okay. And it's sound medicine. So you're over phlebotomizing. I see it time and time. When you start to dump blood, you're dumping blood for the wrong metric. Do you have headaches and blurry vision? Are you really thickened in blood? Again, come on board. Let me ask some questions. I know the deep dive data on this. It's hematology. It's not bro science. Okay. This is well characterized, but we don't know the limits from randomized controlled trials. And you have to understand, I'm a science guy. I can't just wing it and make it sounds good. It's a nice whiteboard and it doesn't work that way. We really need, when we look at cancer and cardiovascular disease, understand that we have to look at real data. We can't just make things up. Please, I'm trying to defend doctors that will save. We're all, guys, stop hating on the doctors and told they have to save your effing life or your son and your wife's life because they're working in hospitals. They're not influencers. I really mean that. And I really mean it. No one knows everything. And it's a tragic time. People are dying. People in this country have no access to medicine. Forgive me. So again, you're over phlebotomizing. And doesn't mean I don't have to phlebotomize my own patients, but I know when and when not to. And you have to look at the CBC and the hemoglobin hematocrit, and you have to look at it in conjunction to the ferritin and the iron studies. These gurus they don't even know, they don't know internal medicine. They haven't worked a day in their life in the goddamn hospital. Let's move on. Number 3, you're on too much testosterone. The average clinic is starting at 200. That's an embarrassment. You don't need that much, but some guys may end up taking 200. I like to start my patients if you're a newbie, which is very rare for me. Most guys transfer their care to me, and now all these doctors and nurse practitioners and I'm training because they're on testosterone from a clinic. Let's be honest. The clinic is not good. The clinic is not servicing. The clinic is terrible. And people are like, guys are scared. Wives are scared. The wives are on testosterone and something happened. They're doctors or nurse practitioners that are in the primary care world or in the hospital. They're like, your red cells are up. You're hypertensive. Like, what is going on? Forget hair loss, gynecomastia, acne, and all the cosmetic stuff. Who even gives a shit about that? I'm talking about serious medical complications here. Okay. So number 3 is you're on too much testosterone. It's notorious. So microdose and figure it out. Maybe you need oral testosterone. Again, testosterone injection esters are king because they are very effective and they're accessible. Some of these other things are the injection. Zyostat, it's expensive. It's actually an injection, but they have a patent on the injector, not the drug called enanthate. They don't own that. They own the injector. And it's really nice and easy. $300 a month. You can't compete with a vial of testosterone cypionate or enanthate. I don't know what it is, 40, 50, $60 a month. And the needles and then the syringes, they're dirt cheap. They're nothing. Right? So this is where they can't. And then you have the topicals and the pellets and the nasal gel even there, which is kind of funny. And then the oral stuff, which could be good, but the compliance is bad. People don't want it. They can't take it. The old school injection is king. Taking too much, understand it, the least effective dose. I've been on this stuff for 35 years, guys. I live it. I'm from the streets. Let's keep going. Number 2, most common, most egregious medical mistake, blood pressure. Federal government, FDA, they just removed a black box warning on testosterone, on all testosterone products that said from 2014, 15, they stamped the black box. Testosterone itself can cause heart attack, stroke, and death. You could fact check it. And I saw it come. I've been a physician since, I don't know, 2002, residency, graduated in 2005. I was a real doctor then. 2005, I guess I've been a real board certified internal medicine doctor. 2005. Before that, it's been training for a million years, right? So, okay. The Fed did that. And then I remember the arguments. It was from two big studies, and I don't want to bore you with that. And then some of the experts, including me, looked at it and we questioned the methodologies. And we were like, is that real? I mean, is it real? I mean, does it really make sense? And then, of course, it was scrutinized and it took a long time. And then, lo and behold, last year, they removed it off. They removed the black box warning. They don't do that. They did. The FDA, they did. Now we're involved with, because the Testosteronology Society is involved with this openly, right? With the testosterone panel that you could look at in the FDA, trying to we have to redo. It's time to make a redo. We have to readjust. And hopefully we're going to get it off the controlled drug list, because it's been on there since 1990 because of MLB and like bodybuilding and Olympics. That makes sense for me and you. It's limiting the average bear. Okay. Not to mention bear at people. So, and not kids. So second most common problem, they removed one warning and they put blood pressure on. It was never on there before as an independent black box warning. I want you to check that. You're going to go, wait a minute. They remove heart disease, stroke, and death from a global black box, but they put back on hypertension. Now, wait a minute. Number one cause of death in the country, I want you to fact check it. Google, number one cause of death. It's actually the world now, but we'll say America, right? So it's cardiovascular disease. Holy moly. What causes cardiovascular disease? 3 things. It's really simple. Diabetes, blood pressure, and bad cholesterol, which is complicated and doesn't fit for everybody. But those are the big 3 modifiable cardiovascular risk factors. Trust me, it is. And I'm not selling you nothing. No statins. You take nothing. Good for you. Okay. So most men on testosterone, they're hypertensive. If your blood pressure is 120/80, that's level 1 hypertension. Again, you're going to fact check that and go, wow, I can't believe it's level 1 hypertension. What does that mean, level 1 hypertension? It means that if you're under that, if you run the curves out, the guy that is 118/78 or lower, and you don't want to go too low, versus the guy that's 120 something over like 82, and the numbers are all over. We know blood. It's kind of like the average. Not easy. This is like an art and science, right? So when you look at those numbers, there's divergence. And this is why you want someone smart. Maybe you don't want someone smart. Okay. The number diverges, and there's an area under the curve. I'm sorry. This is like science stuff. So, and it's significant in the end where the person that has like perfect blood pressure, less than 120, less than 80, their whole life, they're out there. They're rare. Less dementia, vascular dementia, less heart attack, less stroke, and less kidney disease, peripheral vascular disease. And you know what, guys? Less erectile dysfunction. Go to Google, hypertension. Does hypertension cause erectile dysfunction? Holy shit. But I don't want those medicines, because the medicines, beta blockers or even calcium channel blockers, those hurt my erections. Well, if you go on the health portal over here, you're going to learn what tricks I've developed with other experts in the world to make your blood pressure and your cock even better, because nitric oxide. And it's not nitric oxide supplement. It's real medicine, endothelial nitric oxide. It's just true with some great supplements. Number 1, and we're going to move on to questions. The drum roll, please. Number 1, most egregious medical mistake on testosterone and steroids in the world. You have heart disease, you don't know it, and you're taking testosterone, and you think it's safe. Huge medical mistake. So let's talk about it. Okay. I was ready for this. The Fed just pulled off major that doesn't cause heart disease. They didn't say that. They said we're pulling the black box off, but it causes hypertension. Be careful. But the truth is, the trial that showed that, and it's called the Travers trial. All the guys in the Travers trial had heart disease, and all they did was they found out, they looked at who has low T around 300. They double blinded those guys, and they all had heart disease. So they were all being treated aggressively for heart. They had stents, bypass, or they had what's called acute coronary syndrome, or they were really high risk with like diabetes, blood pressure, cholesterol, smoking. I'm obese. That was what they did a great job on this. And then they double blinded and they ran it for over 2 years. And one side of they gave gel and they increased testosterone, but it didn't go up that high as much as injections. That's a point that a lot of people don't know, which is kind of like it's an apple to an orange. But however, over 2 years later, these men, all men, hypogonadal, all had heart disease to start. In 2 years on a little testosterone gel, there was no difference in the two arms, right? The placebo versus the treatment arm, with having a second event done. That's all it is. But it was a very well done. This is tough stuff, man. That's a randomized, double-blinded placebo. This is the holy grail. And they said, therefore, testosterone for men with heart disease appears safe. All I'm saying to you is, do you know if you have heart disease? And these guys did have heart disease, but the guys on both of the arms, they were treated aggressively for the risk factors: sugar, diabetes, pre-diabetes, hypertension, and cholesterol. Again, don't get crazy on the cholesterol, guys. We have a lot of medicines for cholesterol, and cholesterol is not a scheme. It's not a scam or a scheme. It's very complex, and it's fingerprint. But I'm telling you, so many men go to these clinics and themselves, or the steroid guys, and I'm not talking kids. You're 22 years old. Why are you getting a calcium score? I'm not saying it's an embarrassment, but it's like, you're 22, dude. You could do all the drugs you want. Your heart's going to be perfect. You're 22. But if you're 32 and you have bad family history, holy shit, I have bad family history. Like, the guys in my family have heart attacks in their 40s, 50s. Oh my God, I'm biting my nails. Okay, why wouldn't you want to be aggressive? Get a calcium score. Now we have CT angiography with enhanced plaque analysis. If you got a few bucks, if you're smart, I don't know, get a calcium score. And then you go, holy shit, I have some atherosclerosis. Let me look at my This is all the information for you right here. $24 a month, guys. I gotta put a lot of work into this. All right, I'm done. Hope you guys like that. Let's go questions. Let's open this thing up to questions. I'm in the UK. Love you guys. Love the UK. I've been on tier T. I want a jab once. I want to jab once a day. Any ideas? Sir, you're in the UK. I have been on tier T. I am. Okay, sir, you're microdose every day. I don't think it's necessary, but just, you can do it. If I'm gambling right now, you're in the UK, so you're taking either testosterone and enanthate at 250, or you're on Sustanon 250, which I love, and I wish we can get it here. So what I would tell you to do is, if you want to do little baby doses, not for a baby. If you want to do this stuff, the little baby doses every day, it will build up. Sir, it gets tired. It gets tiring. I do it every 5 days, and then I sometimes go, oh man, what day is this? My wife says, you know what? You're pretty grumpy right now. You're like, your estrogen's high. You need your injection. What? Oh, my Lord, it is day 6 or 7. Oh, wow. So guys, again, and I have so many patients like, Doc, can I just do it every Sunday morning? I can't remember every 3 or 5. Who does this? But it is like, it's very interesting that when you look at this, guys, when they start this, it's like a new toy. You're going to get the new car. the Mustang, and you go, I want to go outside and just look at that car a couple times a day. And then, but over years, like then all of a sudden you're driving the car and you're like, I just want to, and you're like, I used to look at that car. I mean, this is like a new toy, but how long can you do it where you need to be injecting every day? There's no health outcomes unless you are very sensitive to these esters. The esters, guys, let me explain it. Propionate, and forget the aqueous stuff like the bodybuilders use. I mean, I know it's aqueous and it's like it's called suspension, testosterone suspension, man. And it's like, let's do it before we work out. Wow, I got it. Okay, everything else is oil esters, old school, 70 years old. Propionate, cypionate, enanthate, succinone 250, and then undecanate is like this is like a half-life of like 8-7 days, right? Prop is like 2 or 3 days. Come on, guys. Everyone knows this. And then you have to understand the pharmacology when you're injecting based on your fingerprint for how your body's going to metabolize it. How does it build up? How does it go? I've done these posts on this stuff, right? With the half-life decay, right? In the, it's not a linear equation, right? It's like, it's like all sorts of different wave forms, not sinusoidal, but half sinusoidal with different decay rates. This is for guys that are really smart in pharmacology. It's really fascinating. But in the end of the day, you just take a small dose, you inject it. The more you can theoretically, when you could break it down and microdose, you theoretically get this even distribution. It is true, but can you do it, and do you need to do it? Okay, next question. What do we got? Any more questions, Mark? What do we serve them all up? There are truth of these peptides being promoted containing vaccines. And that's a cool picture there of the goat. Okay, sir, there's a truth of these peptides being promoted containing. I don't think so. I don't know. Peptides. Let me just spiel on that. Peptide, it's a fragment of protein. To me, an old school science guy, peptides just like, yeah, those are peptide sciences. Now, peptides mean like there's healing BPC 157, TB 500. I'm not making fun of it. I think the stuff theoretically is like amazing. Where are you getting it from? I wish it was really a holy grail. And I think this stuff is going to be good. And I don't want the Fed. I don't want big pharma to get it and to take it. I'm for you guys. I'm a libertarian, really, guys. I'm for you. And I don't, but you understand the research and development and the brand names like Gucci. And don't you want a Gucci or a Mercedes versus a Toyota? I'm so sorry. But it's like, there's higher quality and stuff. I want high quality. So when you look for healing peptides, BPC, TB 500, GLOW, GAUK, all these different things. And I'm not an expert in the peptides, guys. Peptides are everything. So there's Retatrutide. They lump them all together. And then even on peptide sites, there's like growth hormones secreted. Those are not peptides. I mean, some of them could be peptide type, which I know they are. But they're really just medical agents. And is anastrozole a peptide where I can go on my peptide site and get anastrozole? Oh, we just lump it all in. Doc, what are peptides? I don't know. Peptides, there's a million. And unfortunately, the fact that it's not regulated, I'm happy to see that RFK and these guys are saying, hey, here's 11 of the ones that are probably good. We need to make them special so no one's going to get a felony, right, if they're using them. But like, what are you going to do, guys? Don't you want real science? Not just like you did it for your lab rat and we thought it worked. And it's like, again, this is the future, because now how many peptides are coming up every day? You can't even keep up with the peptides. It's crazy, which is a good thing, but it's the nature of the technology and the AI beast. So is there vaccines in there? Sir, no. And I'm not going to go into the vaccine stuff, right? Because I'm a doctor, and I thought some vaccines were not bad back in the day. But then the COVID thing came, and it's just like, oh, man, now we're in a quagmire. All right, next question. Will TRT help me in my overall daily life? I am constantly tired and unmotivated. Sir, I love you for this, Mr. Prototype. I don't know, sir. I mean, you're not motivated. You don't feel good. You need an evaluation. Come on the health portal. Ask questions. We'll try to help you the best we can. So that's a great general chief complaint. If I had you as a patient, it would take me an hour and a half, probably longer, right? So, brother, I'd have to open you up, ask a million questions. Family history, drugs, alcohol, how much you weigh. I look at your ABCDs and boom, 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 blood. So I don't know, sir. Just don't go on testosterone. But really check out your ABCDs and come on. It's a good question. Doctor, I'm 31-year-old male. I have a removed testicle after which retained up in my stomach. So I had it removed, right? And I was fixated in my groin. My test is 220 nanograms per deciliter. Wow. 31-year-old guy. Guys, hold on, Mark. Keep it there. 31-year-old guy. This is the good stuff up my alley. So you have what's called cryptocoidism. Cryptocoidism, where the testicle is sitting up in the abdomen, and when you're going through gestational development in the mama, before you're born, they should have dropped into the inguinal canal, and then the little boy has testicles. But and if it doesn't drop, it's called cryptocoidism, and it's usually unilateral, right? Because of that, the increase in risk for testicular cancer is significantly. I'm a primary care doctor, as you can see, but I have men's health, so I really know this. You remove your testicle because of your increased risk for testicular cancer, and you're young, right? Or it was achy, or it was twisted, and that's a torsion. So you have your unilateral. It's called a unilateral orchiectomy. And you have one testicle left. Real quick story. 15 years ago, a primary care doctor taking care of little old ladies and people in the community. Guy comes in about your age. Doctor, hi, I'm a new patient. How you doing, sir? Yeah, doc, I had testicular cancer when I was like 20 something, and they removed a testicle. So he goes, doc, I'm flying on one wing. I'm flying on one testicle. I go, okay, all right, I've heard this. And he goes, my testosterone levels were like 400. And he was like, should I replace testosterone? I go, hold on a minute. I called this doctor. I called his urologist at Sloan Kettering in New York City. Doctor, Tom O'Connor here. Does this guy need to? He said, Tom, it's interesting, but most guys that are young that we remove a testicle, the other testicle picks up and they're okay. Like you could remove a kidney and the other one picks up. Yeah. Be careful giving stuff. So taking organs. So look, sir, this is a good question. And your levels, I'd have to look at the levels that are in this. I think everyone's from Europe here, right? In my metric system, I would have to look at it several times, at least twice. Again, I'm trying to give really good information, including the free testosterone, sexually binding globulin, right? Your prostate, your health issue. You can't make a decision, gentlemen and women, just jumping on. You need the best health care, which is here, testosteronology, internal medicine, super, super excellent healthcare practitioners. And I've taught them as much as you could possibly know on testosterone and androgens now. This is the whole world. So, sir, it's a great question, but I want you to look more into it. You could allow us to help you. I'd love to. We love new questions because with AI, imagine we're geniuses on geniuses here. I mean, we take AI, we run some of the stuff through AI and just brings us to a new level. My top testosteronologists, these are the chosen ones. You see the ones on go to testosteronology, look at providers. These are the chosen ones. Okay. So, sir, that's a great question. And I can't answer that. I don't even see you. I don't know, but it's a great question. You have one testicle and you're not old. How's your sex? How is your testosterone overall from the circadian rhythm standpoint in the morning, at the night? How do you feel? How's your erections, man? Are you in a relationship? Do you want to have children? You have one testicle. If we give you testosterone, we're shutting that baby down. All right, let's keep going. Next question. Sir, please get on the portal. Let's go. What antibiotics can I be on? I love this stuff. With coronary artery disease, 40 years old, with a big family history of heart disease. I just had a quadruple bypass. Oh, my Lord, sir. Whoa, this is the kind of stuff that I see. This is real stuff, guys. Bypass surgery 4 months ago, still doing tests, though. Brother, you're a 40-year-old guy. Guys, this is real. He's a 4-year-old guy. He had either heart attack or chest pain. He got into some medical facility, and they went to the cath lab with him, I'm assuming, and then they tried to put stents in the guy, and they said, shit, we can't stent you, bro. Call the thoracic surgeon. And then the guy came in and ripped open your chest, and they did a quadruple bypass. Welcome to, this is nothing new. So, and because your family history, I told you guys, family history. Medical mistake number one. This guy, thank God, is alive. Brother, I can't sit here and, hey, dude, you could take some Anavar, just be careful with the trend. And dude, stay on testosterone, brother. Stay on testosterone. This is just testosterone. Come on, guys. I'm 62. You, sir, I want to protect you. You need the ABCDs, A1C, blood pressure, cholesterol, ApoB. You probably have LP little. I love the lipid stuff. I love the heart prevention. Guys, with technology now, it's freakish. Nothing more than worth my pen. I have these different, I love my drug. I love these cardiac drugs because I could almost I could do steroids I don't do that. And that's bad information, right? I want to keep the kids off steroids. But the truth is, who doesn't want to feel good as you're getting older? So, sir, be careful. You're just on test, though. I want to say it like that. You're just on test, though, bro. So that's okay. Keep it to a down low. You don't need much. Sir, if you have heart disease, you already have had a bypass. We have to prevent you from not having another occlusion, another blockage. You already have cardiologists. So this is a great, again, if you ask more and more specific questions on the health portal, we will be able to, again, ethically, and in the health portal, we ask questions. We just see your age, you're a man or a woman, because we have women in there. We're open to women. And it's your age, you're a man or woman, and this is your medical question. And then you give us as much pertinent medical information. We make a video. And give it back to you. You've never seen this before. Next question. Please be careful, sir. You're on testosterone, easy as she goes. And don't tank your HDL. Be very careful. ABCDs. Do you think they will ever take the Schedule 3? Dude, awesome. Here's a secret, because I'm working with the Fed on this stuff right now. Here's a secret. Not this year. Next year. Next question. Next year. It's going to happen next year. Do you think okay, next question. Oh, my Lord. Who's this? What's that? What's the guy with the crazy Marilyn Manson? Okay, I felt better when testosterone was 239 before tier T. Now I feel now. I feel better. Okay, here's what happened. If I'm just gambling, you started testosterone at some clinic or with a doctor, and I love doctors, but urology doctors, you need to surrender testosteronology and get back in the goddamn operating room. You're surgeons. You shouldn't be doing this. Stop it. That's like me going to the operating room. If I go to the operating room, take my license away. That's going to be dementia. Okay. You're a surgeon. Get in the operating room. This is a medical specialty. Okay. Sir, probably what's happening is you're not getting the right dose of testosterone, and they're either giving you too much or too little, and they're shutting you down. They're giving did you realize that you can take just a little bit of testosterone, and if it's not enough, that you actually shut down the guy's natural testosterone that he had? At least he was feeling somewhat good, and then you're done. This is where doctors really need to understand the science of giving testosterone. Okay, I don't know, sir. So I assume that's what's going on. But again, come into the health portal, and I need more information. The more information that a doctor I could have, I'm going to give you a finite response. Let's go. Next question. See, I'm getting pretty good at these class questions. I'm moving right along. We can't have the guy live. We're not doing that. We're just going to, there's a million questions. We're just going to
talk it up, try to get people to show.
Okay. Can we do it though, Mark? Can we?
Yeah.
How do we do it? Doc, let me ask this question. But go back to the next question. I want to see guys.
Yeah, so
what?
Tell them to go to that link.
Oh, you guys, if you want to be seen and ask me a question. And if you don't do it. Go on stage. Mark, help me out.
They can be voice only.
Oh, they're voice only?
They can be voice only if they want to be anonymous.
What happened last week? We don't have that right now where they can be visualized.
They can. They have to go to that link.
Guys, put the link up again, Mark. Guys, go on stage to ask your questions. Go to testosteronology.com/stage. You may turn off your camera. Okay. Maybe they can turn it on. Can they turn the camera on and I can see them?
Yeah, it's their option.
Okay. Let's keep going, guys. Let's see the next question. Doc, do you recommend low-dose aspirin to avoid blood clots? Oh, my Lord. Doc, sir, do you want me to talk for 6 hours? Okay. This is a loaded question, sir. The answer is no. Let's talk about why low-dose aspirin is FDA, or I know you guys don't like the FDA. I don't like the FDA sometimes. Okay. Let's talk about the indications for low-dose aspirin. Number one, low-dose aspirin. Number one, you have coronary artery disease. You've had an event. The guy with the bypass, oh, he's going to be on not just aspirin, but probably Plavix, right? A complicated world, right? Antiplatelet, dual antiplatelet, very complex now. So the guy is, so if you have enough heart disease, like your calcium score is like legitimate, and you have risks that you could have a myocardial infarction called a heart attack, you'd want to take a baby dose of aspirin. Now, when you start looking at TRT and the relationship, this is my D, to the buildup of the red blood cells, it's a loaded question, sir, because it's way too complex. But the essential answer is no, unless you have some risks that I know the risks that pertain to legitimate low dose aspirin utility. Because if you look for some of the recent studies that I want you to fact check this. And this is all I do, guys. It's the same thing over and over. Heart, kidney. So you can look, you'll see that just giving people aspirin, if they don't have enough risk to outweigh like risk benefit analysis, they get bleeding. And if you're certainly when you're getting older, don't call me old, but 60s, 70s, 80s, people will have gastrointestinal bleeds, and fact check this, hemorrhagic bleeds, especially if you're hypertensive. This is deadly stuff, guys. Deadly stuff. So there's a benefit. There's a risk benefit that I run on every single patient, and I check it. Now, if you look for aspirin utility, I like low dose aspirin for some other features, like if you have colon cancer in your family, like Lynch syndrome, and you're going to fact check this. Holy shit! But guys, this is all I do. I like the utility of that. Okay, but just to use aspirin if you have thickened blood, it's at 17, is it 18 grams per deciliter? The data on that, sir, came from doctors that meant well decades ago, where they're looking at polycythemia vera. Go to Google, polycythemia vera. It's a malignancy line that affects not just the red blood cells, but the platelets. This is an antiplatelet agent, right? And also the WBCs. Okay, now, and they this is medicine in the streets, right? There's no studies saying that you should take aspirin if you're on testosterone. There's nothing. But they said, wait a minute, if you have polycythemia vera, or any polycythemia secondary to androgens, but they're making it up now, you should take, therefore, my doctor said, take an aspirin. It means well, but it's wrong. There's no data to support it, because the line in which you have increased red blood cells, not to mention iron, which is not the red blood cell. The red blood cell holds 4 atoms of iron tightly. And then you can look at iron apart from it. Come on, guys. Come on. And you can look at deposition of iron with ferritin and saturations and transference. Come on, guys. I mean, this is just a super deep. If you want to join this and learn from me, let's go. It's internal medicine. I'm just talking here. I go from neurology, hematology, cardiology, nephrology, psychiatry, and then I go back all the way around. This is what it is on androgens, right? This is a whole day job now. So great question. And the answer is no. But it goes back to like is your blood thickened, and do you have potential danger because you have androgen-induced erythrocytosis? Don't say polycythemia. Don't. I'm trying to correct that. And the doctors, I have to slap that doctor hand. Stupid doctor. Sorry. Because it's just a categorical error. You're not saying it right. It's androgen-induced erythrocytosis. Go to Google. And it's very specific, and it's only the red blood cell line and all the indices. And are you bleeding? Do you have hereditary hemochromatosis? Do you have thalassemias, sickle cell? Come on, guys. And have you had a stroke? Have you had the guy that has the bypass? I got to put some extra love in the guy. I have millions of guys. I have thousands of people like that. This is how I cut my teeth. I still take care of patients that have all sorts of, from healthy guys to guys that I've had 10 heart transplant guys. I have 1 million kidney transplant guys. This is complicated stuff. Next question. Been on 100 a week for testosterone 8 years. I'm developed gynecomastia on the left side, thinking about having a surgical remove. Can it come back? Oh boy, great question. You know what? You know what I like about this guy here? So you got a little gyno. There's 2 types of gyno. One is sensational, where, ooh, it burns. Oh man, it's burning. It's annoying. And the other one is you see it. It's a physical mass. And I always worry if you go to a doctor, any good doctor, nurse practitioner, I got a mass right here. Holy shit. They're going to think it's breast cancer until proven otherwise. And that's good for them. But we know that testosterone and steroids actually, they don't cause breast cancer. We're talking men. What's the percent of men? Breast cancer, 99% women, 1% men. Go to Google. Go to Google. You're going to be like, holy shit, he's right. 1 out of 100, man. You ever go in a block outside in a beach and go, 100 people I'm looking at right here. 1%. One guy's got breast cancer. It's crazy. It's kind of like weird. So look, I've never seen a case of breast cancer, and I'm the anabolic doc. I've been doing this really for 20 something years, right? Full time. And that's just like, thank God. I've seen breast cancer on probably half a dozen patients when I was a primary care doctor, and of course, working in the hospital systems in New York and Hartford, Connecticut, right? These big systems. So I was rounding on, like, that guy's got breast cancer. Wow. You know, it's genetic or alcoholism with liver disease. Fact check that. With like just having a disproportion of estrogen with low testosterone. You see, not high testosterone and aromatization. That's a whole nother animal. This is complicated. And then that's why, you know, let's just use tamoxifen and AI. No, God, no. Come on. I mean, can you make an argument we should live on test and Masteron, because Masteron is a drug that was utilized 60s, 70s for metastatic breast cancer, mainly for women. But they don't use it anymore because we have other adjunct, we have other chemotherapies, and those are oncology doctors. I respect them. So, sir, this is a great question. I really bring it back up again, Mark. What was the question again? I'm getting tired. So I think if you have gynecomastia, you should go to a great surgeon. This is going to be a specialized surgeon. If you don't like that, like most guys just go like, yeah. And what is gynecomastia? If you have like male boobs, and again, guys, I'm not perfect. I don't want to take my shirt off at the beach anymore because I'm just not. I'm like a bigorexia guy. I don't feel great about myself. I feel good doing that, but I don't feel good with my shirt. And I'm me. And that's me. I used to. So it's like, but do you have body habitus, or do you really have gyno? And I could tell you, if you're very, very lean, you'll get rid of the habitus with the male boobs, but then it could accentuate. I ain't no plastic surgeon. It accentuates the skin. And if you're older and go to a plastic surgeon. I get Botox. Okay. Go to a plastic surgeon. Go to them. But go to a good one that does gynecomastia. Go to Google gynecomastia. Look at the reviews. Because if you go to a general surgeon, and if we're outside the world here, here's what happens if you go to a regular surgeon that goes, yes. What, are you a surgeon? Yes, sir, I'm a surgeon. What kind of surgery do you do? I do everything, son. I'm a surgeon. And that's like, holy shit, no. Plastic surgeons only that do gynecomastia. You can go to Google. There's this guy, doctor, I'm going to say his name. I don't really like the guy. We got into a fight. I get in fights with other doctors. I fight doctors. So Mordecai Blau, Dr. Blau, New York City or White Plains. Guy's as old as the hills now. As long as his hands aren't shaking, this guy's got to be really good. This guy's just an arrogant guy because he's like, hey, Tom, you see the freaking Lamborghinis and this and that? I get $8,000 per. I do like 6 a day, man. He probably didn't have the accent like that, but he said all those. And it's just like, but he's so good because all he does is go to a surgeon. Remove it. Let's keep, and don't use aromatase inhibitors. Do not use, this is a medical mistake. Number 6, maybe number 2. Guys that say, the gurus and the coaches and the clinics, hey man, we're gonna just keep you on an AI, maybe even like tamoxifen or raloxifene, and we're gonna reduce that mass. That is so unethical because you ain't going to reduce that mass. You just may have a chance you think it goes, but you're destroying the person's central nervous system, heart, and joints from crushing their estrogen, all to reduce this little area that the surgeons have told me. They're like, Tom, these guys don't getting them. Once you have gyno, it's a fibrotic, hardened mass. Okay, of the mammillary glands. And again, with the grace of God, is it cancer versus not? The guys, you have to understand the real world of worrisome medicine. We go to Z and we come back. We always think it's just embedded in us. The worst case scenario, and we start excluding, not that the other guys go to the other way. What can I give you? And what do we do? And I want to do this and maximize bullshit. You start from shit. What is it? Let's make sure it's not this, it's not that, it's not stroke, it's not cancer. And then we work backward. And then sometimes we go, you know what? Good news, bad news. Good news. It's not this, it's not cancer, it's not this, it's not a stroke, it's not your kidney, it's not blah, 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 blah. And then at the end of the day, I don't know what it is. That's an honest doctor. You can't know everything. Next question. Okay, so Mark told me, can the gyno? It can come back if you don't go to a good surgeon. And if you go, I know I'm all over the place a little bit, guy. I'm getting excited. It's been a long day, but I'm going to keep going. So I've seen so many guys go to bad surgeons, and you know what it looks like? It looks like ice cream scoopers. Ice cream. Your nipples are invaginated. I've seen so many guys come into my office like, Doc, look at this. And they pull the shirt up and I go, oh, man. And then I have to send them to a reconstructive plastic surgeon to try to fix it. And it's hard to fix. Go to a good surgeon. Like medical. Go here with us. Don't get away from this craziness and come to a legitimate traditional physicians and healthcare providers that are spending our days working on people that are on testosterone and steroids. This is it. This is a legitimate specialty now. Let's keep going, guys. What's next? My test is 200, so my doctor won't prescribe it, says it's under the 2, LOL. My test is 200, so my doctor won't prescribe it, says it has to be under 200. Sir, dude, get a new doctor, bro. LOL is right. It's like 300, doctor, and we don't even look at the numbers like that anymore. We look at the numbers, and then we do the hit. How's your clinical? Sir, go on the health portal, go on, find a testosteronologist, find a provider, and if you're in America, get one of our, there's no healthcare provider in the space of TRT and harm reduction and steroid protection than the testosterone. It's just not possible. No one can compete. There's no, come on in, surrender to us. To healthcare providers, time to surrender and come up to the highest standard of care. Let's keep going. I'm trying to look for, I want someone to argue me one day, you can see. So, I get bored. So which is better, cypionate or enanthate? Great question. There's no difference. Let's talk about a very subtle difference. Cypionate and enanthate are esters that we see to be very similar from a molecular standpoint. It's the hydrocarbon fatty, it's the hydrocarbon chain, and that's enanthate versus cypionate. And that's all. They're slightly different with the hydrocarbons. This is a bro science pharmacology, like a organic chemistry or like a biology question. And it's the half-life is literally, everything else is the same, but the half-life is enanthate is a little 1 day shorter. But it kind of depends also on your fingerprint. So cypionate and enanthate, we always say, which is true, that essentially they're pharmacologically similar. They're equal theoretically. But guys, I know that this guy loves enanthate. Doc, I have to have enanthate. And this guy has to have. Okay, it's okay. But the real difference is that. And there's no studies on this, right? Head-to-head study, there's no one's doing it. That would be a cool study. That would be cool. Head-to-head trial, cypionate and enanthate, and then double-blind it, run it for 3,000 guys for a year or something like that. But starting them de novo, like new, and ask questions like, how's your sex? How's your intelligence? Can you do math? Is your wife mad at you? Are you snapping on people? I mean, and then strength and all. It would be fascinating to see. My guess is there'd be no difference. So, but the kinetics are different. And you know what's different? The kinetics, again, the half-life, a little different. But you know what's different is if you make it in different oils, this is where the money is. Guys think it's cypionate or enanthate they're going to try, when the truth is, when you look at, say, the pharmaceutical grade that's in America, in Walgreens and CVS, which is theoretically, excellent. I'm not saying that compounding places are excellent. Some of them, no names mentioned. But when you look at the standard stuff, they're in linseed or cottonseed oil. But we know that you could make it with grapeseed, MCT oil. I'm showing off to you guys that know this. And those, for people, there are subtle differences, not to mention, there's skin eczemas and allergies. And when you're using different, I asked this to our Omar Hachmosa, who's our farm PhD. Omar, he's my chief of education and strategy. Check out who this guy is. Go to the portal and check out, who's on the team, on our executive team. And he explained to me, he said, Doc, when you change the oils and the solvents, it does change sometimes the kinetics and stuff. So very, very deep question. But enanthate and cypionate themselves as a molecular testosterone esters, they're very similar except for 1 day different half-life. Enanthate's a little shorter. Let's keep going, guys. Love you, Doc. You have helped me a bunch in my journey. Thank you so much, sir. That helps me hear that. Because it's not always easy doing this shit, guys. Definitely doing the best I can for you guys. Trend, should it be feared or avoided? Oh, the trend guy. Knew the trend guy was out there. Dude, trend, you ever hear of something too good is too good to be true? That's trend. There's steroids, then there's trend. I mean, trend is kind of sitting over here. And we could dissect it all night long. It's a nandrolone derived and all that. The bro science guys have always been very impressive to me. Because when I was writing in the magazines, when the anabolic doc back in 2009, right, to on and off for about 10 years to 2019 or 2020 or something, I worked with some of the top, bodybuilders and some of the biggest influencers in the world. And Bill Llewellyn, remember Bill Llewellyn? Put that in Google, Bill Llewellyn, hard to spell it. And the anabolics, man. So tren, acetate, enanthate. And I just a regular guy from the back in the day where I did some old school steroids. I tried tren maybe a couple times. Holy crap. Coughing. I almost called 911. The tren cough. I couldn't believe it. And then the anxiety. I almost had a panic attack, guys. And I'm a pretty robotic, tough guy. And I was and sweating the bed. All right. So, guys, tren, man, I mean, I don't think if there's a utility for tren unless you're a pro bodybuilder. And then if you're a pro bodybuilder, I just want to hug you and cry for you because you're going to destroy your heart and kidneys. There's no way to get around it. And I'm not talking about who's out there today, because I know some of these guys and I've been the doctor to some of these guys. And it's just like, it's scary right now that the young guys are using tren. And it's scary that they're very matter of fact and flat. Like, yeah, I know. I may not even make it till 40. And they're like sober. This is why men, I think, are warriors. Yes, sir. No, sir. Men go to war. And I'm not going to be Mr. History. I'm not going to be this weirdo right now with like, but guys say that, man. Like, I'm ready to rock and roll, bro. That's what I do. And the adrenaline and the dopamine of being on social media, man, this is just, and being like, again, guys, it is what it is. But I didn't grow up in the 80s and 90s, dude. I mean, hold on. I grew up in the 80s and 90s. I didn't grow up around tren. I knew it was at parabolin. I know it's out there, guys. And I saw a guy putting tren on, the acetate. He was putting it on with saran wrap. He was like, he said he wasn't on steroids. We were like, this guy's a monster. And then we caught him. We went to go pick him up one morning to go to the gym. And we're like, we're coming in, buddy. And his door was open and we caught him with like the saran wrap on with the tren arms. We were like, I can't make this up. And I was like, holy shit, dude. He was like, guys. And we looked at the table and we were like, holy shit, dude. What is this? And all right, guys, I got to talk to you guys. All right, bro. We know you're on steroids. You're a monster. He was like doing 405 for 12 reps on the bench. I mean, I had to check my ego at the door when I went into that gym with this guy. It was brutal. So, tren, unreal, dude. I don't know. Be careful with tren. I mean, I would stay away from tren unless you're like this warrior and you have to be a pro bodybuilder and you're going to destroy your. I know if you're young, you can get away on and off and this and that. It's health reserve. Health reserve is this big, but you're chewing into it. And it doesn't show on the labs. It's such an embarrassment. Do your labs. My labs, I look better and better. Take a rubber band. Keep pulling it. Keep pulling it. Keep pulling it. This is my rubber band story. Pull it. Pull it. Pull it. Right before you pull that rubber band, you let it come back. Look at it. It looks normal, but you pull it, it breaks. But the rubber band that was sitting there, never touched, like say in a glass vacuum in the closet for 100 years, you could pull it. It's never been touched. Mechanically, when you use these steroids, they really do. They're taking health reserve out of your organs. No one's going to argue me. It's not possible. You have tons of health reserve when you're young. It's just a gamble. But if you have underlying health issues that you don't know about, this is where the straw on the camel's back. I mean, come on, guys. I've been doing it. No one's been doing it as long as me. And all these guys that are not doctors, they don't see the doctor side, the hospital side, the pathology report side. They don't understand these pathophysiologic paradigms. And I'm still around. So be careful with tren, dude. I'm like an old school guy. Can we bring back old school? You got to be like a man to take steroids or a woman, an adult, and then don't take much. And you're going to get shut down. And all the side effects, cosmetic, well, that's not going to kill you, but suck it up, buttercup. And as far as your balls and your fertility, well, we'll do the best we can. It's going to be other injections and all that. And maybe you're going to have to lose this girl because she's going to say, hey, you know what, sir? Love you. I got to go. Why? I got to get a kid. I've seen it, guys. Don't kid yourself. Not all these broads are going to accept this. I'm just telling you, call me crazy. Call me crazy. It's kind of, we're old. In these new broads and new kids, they're not going to change. They want to have children. And if you can't give a kid, yeah, we know Ronnie's got 9 kids. Don't compare to Ronnie. He's a beast. And we're not going to go into Ronnie. I love this poor guy. I mean, it's sad, right? We're the same age. It's sad. He's no free. He's a true guy. He's an honest guy. Here he is, man. There's no free lunch. And I'm not going to use that much. I don't want to be on that level anyway, this and that. Well, then don't do it. And some guys can walk away apparently. How old are they right now? I don't wish these guys harm, but I've taken care of a lot of these guys. Woo-hoo! If you knew what was really going on, man, you couldn't believe it. It's just like they have chronic kidney and chronic heart disease. It's sad. But it's like that happens to people anyway. Okay, let's keep going. Next question. I'm trying to get these guys to understand. Easy as she goes. What about 350 a test E, 1 mil a week benefits? Oh, Adam Legg. Dude, I mean, 350, that's steroid dose, but it's not the I mean, it's a steroid, it's testosterone nanthate. 350 milligrams a week is like a steroid level. Back in the day, guys would do 1 milliliter of sustanon. I took care of some of the famous guys. They powerlifters. Forget bodybuilders are kind of wackadoodles. I'm sorry. I'm sorry, guys. Wackadoodles. It's like powerlifters back in the day, 70s, 80s. You know, they'd live on a cc of sustanon 250. And then they'd ramp up and stuff, you know, for the meets. They knew they couldn't do more than like 2 or 3 meets a year. I'm just telling you the truth. And these guys, look at Louis Simmons. He lived to like 70-something years old. God rest his soul. Unreal. I knew all the. I met Louis. Louis took me to breakfast or lunch, and like I don't know if he was threatening to like hurt me if I went off the reservation or something. And I was looking at his wife. Like, what is Louis talking about? Great dude, great. Then he gave me all this gear. He gave me not gear, but like shirts and the West Side barbell. I mean, guys, I've been around. So, sir, 350 of a nanthate. I mean. It's a steroid dose, but it's like, are you ready for it? Are you doing it? Like, it's a lot. It's not like 1,500 or a gram of test, but you don't need that much. Again, guys, old school, a little bit goes a long way. If you just want to be strong and have a family and take care of your heart and your kidneys, look at me, Mom. Okay. And I intend to live to 110 or 20, but I use all the technology, right? Maybe that's why I'm looking like, I don't know. Like my heart, my kidney, when you have really good heart and kidney function, you're going to look young. You're going to feel young, more importantly. And your erections are going to be great from real truth. And you're going to have stamina. Your brain is going to be great. And you're going to live a long life. And quality of life is everything. I don't want to live one day. I have to get attorneys, I think, to tell my wife, like, if I'm ever paralyzed or like on, life support or something, I swear to God, don't keep me going. I will throw myself I will get somehow over to chew on something to kill myself. I mean, there's no way. Quality of life is everything, guys. But what? Don't you want to live a great quality of life? If you're hypertensive, if your cholesterol, your kidneys, it's fun to work on. Health portal. Next question. Could you do glutathione for doctor supply 30 mils with vials of 200 connection? These doctors are script for IV. I do, but can I do 1 cc every other day for 2 months, my own injections, and get the same result? Love the question. I've looked into it for myself. I like glutathione. I like it for the liver. I like it for the restorative. But the truth is, I'm a data guy. And I don't know about this. I know like if you do too much, there's like this sweet spot and you don't want to be too toxic on it. Funny enough, like the paradoxic, right? So I don't know this stuff, okay? I don't know everything. But my feeling on this stuff is my endothelial, you're looking for protection of the heart and kidneys. Well, take it from a different perspective. Look at it like try to stay as lean as you can. Don't smoke and drink, right? If you drink, so like take it easy. Try to lower all the risks. Do prevention. Look at prevention. Your ABCDs. Skin cancer prevention, colonoscopies. If you have heartburn, get an endoscopy. Oh my Lord. I tell guys in my own patients and on the health portal, I tell you guys what to do. And last month, a patient of ours who's 50-something, he never had a colon. He went for the colonoscopy. He has colon cancer. But they said, thank God you did the colonoscopy. You should have done it at 45 when it was everyone 45. They lowered it. but no one's doing it because everyone's disenfranchised. I'm not going to go into politics yet, guys, but if I do, it's going to be all about getting medical care for people in America. And we're not going to call it socialized medicine. We're just going to get medical care for everyone. I'll figure it out. Okay. So glutathione, sir, glutathione. I don't know that question, so I'm going to have to move on. But I like it. But I don't. No one is going to argue me that there's is there randomized clinical trials on it, and you're going to be, oh, it's this Dr. O'Connor is so annoying. Like, of course we don't have it. Well, why don't we? There's been some studies on not randomized clinical trials. Well, you can't afford that. Oh, well, I mean, someone would make money on. I don't know. Well, it's not patentable. Okay. I'm just trying to get in my brain, right? You're saying so, but does it really have health outcomes for you potentially? I agree, but are you deficient in vitamins? And again, it's a rabbit hole. But then, when guys are going for this kind of higher, low hanging fruit, ABCDs, and then if you're beyond, hold on, if I did a health history on you, I could guaranteed. I haven't seen the healthiest person in the world. I will find something, 100% guaranteed. I will run the tight ABCDs as an academic internal medicine concierge guy, and I will find not just one thing, but a whole plethora of things that I could improve, but not with these IV drips. I'm not against the IV drip. A woman just died. They gave her the IV drip too quick. Potassium must have been in there, I assume, and she arrested, cardiac arrest, man. Those guys are done, and that's rare, and that was a tragedy. But I don't know, guys. If you're drunk and you're hungover and you get the IV, bro, and you're feeling better, I don't know. I just go to a diner and have like eggs and bacon twin cheeseburgers and Diet Coke and go to sleeps. I mean, that's just kind of how I do it. I don't know. I mean, I like ABCDs, and I'd like to see someone argue me with A1C, blood pressure, cardiovascular evaluations, looking deep into your fingerprint for your own lipidology, okay, in your family history, and then genetics, and then use diet, exercise, some very good supplements, right, but not the IV drip stuff. But I don't mind that if you're deficient in it and you want to move forward, but be careful. I got to keep going. All right. Great question. I'm assuming you wouldn't recommend a SERM like enclomiphene alone for improving hormones. No, I do. Many clinics are doing so. Sir, no. Let's talk about the spectrum. You're a man, you have low T or low T-ish, and you want to start testosterone. But you're like, oh, hey, man, I don't want to start the injections. I don't want to shut my testicles off. So this is from left to right? So that's kind of the end right here, right? And most guys just end up jumping on that. But that's steroid guys, right? So, but if you have low T-ish, and you want to just boost your testosterone with not a testosterone booster, from a supplement, but real clomiphene, let's talk about clomiphene versus enclomiphene. Do you know the difference is, sir? You ever see you think the right hand is the left hand? Remember the OJ case? If the glove doesn't fit, you got to acquit. Okay, the glove doesn't fit, you got to acquit. Okay, right hand, left hand. These are different. These are stereoisomers. Right hand is clomiphene. I believe it's the other way around. Left hand is clomiphene. Right hand is enclomiphene. And that stereoisomer in the world of the molecular structure pharmacologically does have slight differences and may be more effective with its vector, with the receptor. I do agree. Okay, clomiphene and enclomiphene, selective estrogen receptor modulator. You're right, sir. And I've tried, guys, I've been doing this 25 years. I've started, I don't know how many guys, maybe 150, couple hundred guys over the course of that time, where they're coming to me, they don't want to start testosterone. No, they've never done steroids. Kind of like a 30 or 50 something year old executive. And he's like, oh my God, doctor, I don't injections. I don't want to take steroids, my hair, my testicles, but how can we increase testosterone? All right. Clomiphene. Now we have enclomiphene. That's it. And for fertility too, and it's part of a steroid, rehab and the post-cycle therapy. Come on, guys. It's very simple stuff, actually. There's only a few things in the tool bag. It's actually quite simple. So clomiphene and clomiphene. I like it. Here's the problem. Here's the notorious. Great question. It's going to work. 12.5 milligrams, not free. I don't give advice here, but the average bear, 12.5. It's half the dose of clomiphene because it's probably the receptors are more accurate and they're more precise. Voila. I believe there's no studies really on this stuff. I'm talking randomized clinical trials, but there's some studies and anecdotal medicine is huge where I've seen 1,000 guys and that's anecdotes. That's the doctor who has the experience. That's why you pay for that doctor. Okay. Or these doctors that are here, the nurse practitioners. Look, you take enclomiphene or clomiphene. It works. It tricks your brain because it blocks the hypothalamic receptors for estrogen. This whole system is blocked and your body responds in the brain by increasing LH and FSH. You can measure it. It's kind of how I bust guys. Like, what do you want? I can kind of see what they're on, right? Versus like steroids and what point they're on and what they were taking. So when you do that, it will work on paper. This is what I say when I say it's working on, 1,100. It's kind of hard to keep the testosterone down. All you have to do is just increase the dose. And look, a lot of the urology guys, they're like, okay, we'll start with that. They feel comfortable. It's really that they feel comfortable with their medical license because clomiphene, it's not a controlled drug. It's not crazy. The HCG is a controlled drug in some states, and testosterone's controlled from a federal level. Hopefully that is next year. That's going to come off. Hopefully. I'm gambling. I hope so. Maybe this year. Probably not. Probably next year. So you do it. You look at number. How do you feel? I feel pretty good. But what happens is it doesn't correlate. The number stays high, like 800, 900. You're taking it every day, every other day. There's maybe down regulation. We don't really know. I think it just gets tolerant. And I think what happens is you're producing endogenous, your sperm count goes through the roof. I mean, this is when it's a great thing. But there's a time, guys. I've seen a guy the longest time, 5 years. And then in the end, you're going to transfer over to testosterone. So when I tell that to guys that are newbies and virgins, they've no steroids, they're on testosterone, and I start saying, we do the history, we make the analysis and plan, we look at the heart, the kidney, the prostate, the whole 9 yards. And then I say, I feel comfortable giving you a trial, right? And I'm scared. I don't want to lose my license, right? Because I was under investigation and I got through all that because I'm just helping steroid guys. They were all messed up and I didn't mess them up. I helped them, kind of like methadone maintenance. It's true. So a little extreme. So I don't start a guy. You have to like be low enough and have clinical symptoms. And then I'm like, yeah, it's worth a trial. I'll do it. And then what should I take, doc? Well, I have we have a whole training program on this for doctors and nurse practitioners that want to be testosteronologists. So a lot goes into this, man, a lot. So I'll say you could do clomiphene or enclomiphene. And then well, doc, what is that looking like? Well, you take it and, your testicles will produce more. I mean, your ejaculate, you're going to be like a porn star. You'll be a little, who doesn't want to be a porn star? And that kind of goes away. And then, wait a minute, now my testicles are aching and they're short. I don't know. You can fact check it. And maybe you're going to get a clot in the eye or you're going to get blindness. Holy shit, check it. Clomiphene and clomiphene blindness. Oh my Lord. I don't know, doc. I don't know. 1 out of 1,000. I'm gambling today, man. Maybe I'm okay. I don't know. Sir, it's up to you. We're doctors. We're just telling, sir, sign the paper. Here are the risks. Okay. All right. So you can try it. Try it. Guys, they don't go, whoa. They don't. They go, yeah. Then they see the number on paper and they go, whoa. I don't feel like I'm that though. I'm just telling you. And then you work around and let's try a little more. Let's just, but I'm okay. My tennis game, these are not lifting guys. These are not steroid. These are less like, and I'm not calling them like little, look, they're not bra. They're just not those guys. Okay. Because if you're this guy, you know what you're doing. You know what you're doing. Did you get the memo? Did you talk to Arnold back in the 70s? All right. So guys, it's like, so everyone's doing it. And then you just end up switching. You're going to shut down your brain, we don't have any data. So if you come off, you get this like, oh man. So I end up saying to the guy, sir, you can do, and if you want to maintain fertility for a year or two, that's a great utility. You want to maintain fertility. I could do a rap song. Guys, if you want to maintain fertility and be like, doc, I want to maintain the fertility. I just want to get through another year or two. And I just want to, okay, great use. And then a lot of guys tap out. Doc, you see me tap? I'm tapping out. What do you want to do, dude? Oh, God, this stuff sucks. I feel terrible on it. You could look at all the anecdotes on this in the internet because it's blocking your hypothalamus. It's blocking. For guys that have depression or anxiety, I'm telling you, this is where I don't even want to even try it because I've seen almost 100% of them do poorly, really. And then, so just go on testosterone, dude, suck it up. Or don't do any of this, go away. Okay, next question. I'm on 3 milligrams of Retta right now, along with 2.5 test sip, and I have pushed my ferritin down to 40, doing 30 minutes of cardio a day and leaning too hard in the protein powders. I started 50 milligrams. All right, sir, how old are you? I see a young guy. All right, 3 milligrams of Retta. So Retatrutide is, I did the video with Colette Nelson. It's a GLP, GIP, and glucagon. It's the next level weight loss med that we know preferentially, potentially burns fat. And okay, so you're on Retta, and you're on a little bit of Cypionate, 120, I guess, per week, right? So that's probably per week, and he's pushed it. So ferritin, it's interesting. So when this guy knows stuff, this is complicated. This is like the ABCDs, right? So the ferritin's a storage form. So most men that are on testosterone, they're going to produce some red blood cells. Where do you think the iron comes from? Well, it comes from a storage form. So we know that when you're going to remove the iron out of the ferritin, which is a storage form, so that goes down and it makes red blood cells. Now, you either make too much red blood cells or you make some extra red blood cells, but it's balanced because your body is breaking it. You're breaking down. The red blood cells are always being degraded, and that's in your poop. Your poop, the sterco bilirubin, is actually degraded red blood cells, matter. That's how your body, it makes red blood. It's every 90 to 120 days. That's the whole life cycle of the red blood cell, the erythrocyte. So steroids and testosterone. Now with Retta, I'm just trying to deep dive into the brain here. So Retatrutide, let's say it's something like tirzepatide, which is the GIP, GLP. This one is just adding glucagon. And guys, it's not a drug yet. It's out there in the peptide world. I know a lot of people are using it. I love it if it works, but you're getting it. And I'm not going to say I'm going to say you're getting from Asia, but I'm not against Asians. Okay. But you're getting it from a source that is like potentially the best we can do, doc. Okay. So do you think Retta and Nebivolol should become standard of care? Sir, you can't, this is a bright guy. I love these guys, right? So heart rate back and over. So if you're on Retta, it's interesting, right? The heart rate goes up on people. You know why that is? It's when you look at what's happening with Retatrutide, are you dehydrated? That causes sympathetic stimulation. Are you dehydrated? Or is it doing something to your autonomic nervous system and the heart rate goes up? right? It just can. We these are just generalized side effects that we have to look at. But you're catabolic, but Retta is catabolic. All these drugs are catabolic. You're calorically restricted, okay? And the Ozempic face, you're losing muscle. But then now, just because the glucagon is in action, it doesn't make it anabolic. It just makes it potentially less catabolic. I have to get into your brain, sir. This is real science, okay? And I know it. So that's the beauty of it. And it's really it's shifting metabolism to fat. I know what's going on, guys, but I don't believe it's always really happening. A lot of people love this stuff, and they love like suggestion, and there's placebo. Tirzepatide, I think, is probably the best thing that's legitimate, but I know it's expensive and it's safer. I mean, it's because it's legitimate. But if your heart rate's not good and you're using it for whatever you're doing, and I like Nabivolol, you know I do. You see my stuff. I like the nitric oxide doning effects of Nabivolol for the endothel. I love it. It's been around for decades. This is my baby with my Telmisar and my air. And it's just, no one can argue the science. But are you taking a drug for a drug for a drug? And you look very young to me. But see, these young guys love the science. And, some of the older guys, when they hear this stuff, and doctors that I work with and that I just know, they go, what do they do? They're like, holy mo, I can't believe this is like too complicated for me, Tom. Well, the young guys like this like to play with the technology. So, sir, you're asking great questions, but I don't, you're not a patient of mine, and I want to be careful. I like those effects of those drugs for the average bear that's hypertensive, that needs to lose weight. But again, is it sustainable? Where are you getting it from? And what are the side effects? Next question. But that's a smart guy. I'm 42, did a cycle of 300 tests, Primo, Retta. God, Retta's out there now, huh? I knew it. I knew that. Great experience, felt great. Blood work at 10 weeks looked good, except for low ferritin. Causes for this. Is it common, and best way to address it? Sir, okay, so you did steroids, test and Primo, right? Which is the test Primo, which is testosterone esters with the DHT derived Primo. Awesome combination, but it's just like awesome. Guys love that, right? And then Retta. So you were staying lean and all this, and you felt great, blood work, blah, blah, blah. So guys, what's your baseline ferritin, brother? What's your baseline? Again, you need to look at the CBC. You need to track. You can get this in the health. You can come to let us work on you. This is the stuff I'm here for you. This is the only place you can get this from a legitimate testosteronologist. We know this, but hold on. Don't you wish you had a real doctor, but also knew the stuff? Well, we do now. They're here. I'm here. Okay. So when you look at the low ferritin, what's your iron studies saturation? Are you bleeding from the GI tract? Is there any other medicines that are causing it? Again, this is a great question. I need more information, brother. But I think like the other guy, if I'm just gambling and you're a healthy 42-year-old guy, you're on a little steroids, and then the Retta, I mean, you know what's interesting? When we look at the sodium glucose co-transporters, Jardiance, this is probably one of the most important, conceptual drugs in the world to protect the heart and kidney, so I can keep trucking, and that's a whole, and I'm going to explain this stuff when you're inside the portal, and I'm on this stuff, right? Because it really works now, but it affects the hematocrit. So if you have a problem with that, someone asked the other day, Doc, my real patients that I give these medicines to them in North America, because I have a license, I can work all over this country and even outside, but they have to come here, and I tell them what to do. And so you have all these vector forces. Some vector forces are increasing erythrocytosis, some are decreasing. And then you look at you need to do the CBC with the iron studies, and it looks like you are. But you just said ferritin. What's your iron? what is your saturation in iron and your CBC? If your ferritin is just low like that a little bit, and it's because it's taking it out of the bank, that's okay. Because most men on testosterone, not to mention steroids, are going to use up the ferritin. But are your iron studies low? Are you phlebotomizing, sir? A lot of guys, remember I said medical mistake? Number 4, 5, 4, 3, 2, 1. Medical mistake number 4, over phlebotomizing. And then the iron studies are low, and you're speeding up doctor. We can't get doctors come to me. This is how I started. Doctors in the Northeast, they were sending all their patients to me, even endocrinology doctors, because they're diabetes experts and thyroid and osteoporosis and, Cushing's disease. They're like, Tom, can you do? I don't want to be like, I feel like I don't know anything, Tom. Just take these guys. So New York, Massachusetts, Rhode Island, Connecticut, they were all coming to me. This is my history. So doctors were saying them because they didn't understand the erythrocytosis, all the hematology, and just all the steroid. Now it's just crazy. So you need to look at the big picture. And then at 45, we will get a colonoscopy for everyone. Are you bleeding from the GI tract with the grace of God? Do you have a family history of colon cancer? This is just like, with the grace of God, if you want to live a long, long, long life, you do your A, B, C, D, S's. There's nothing, this is primary care. I'm a primary care doctor, right? On steroids. I'm just joking. So you want to understand, but sir, what you're talking about, I need more information. So get on the health portal and ask the question. Ask the testosteronologist. I need more. Get into the dashboard we built for you. You have your own personal dashboard. You know how much money and time this took? 5 years. A lot of money, a lot of engineering. There's nothing like this in the world. Because in the end, you have access to real healthcare providers that actually know testosterone and steroids for real. Not making it up, and not anti-aging or not guru. Next question. What synergy would you expect to see in a male pushing 50, maintaining 10% body fat? You're currently on just 200 milligrams a week, full body split and high intensity cardio. This is my kind of guy. This guy's all business here. Okay. What synergy you expect to see in male pushing maintenance 10% of body fat? I'm not sure what that means. Synergy. So, synergy. You're doing good, sir. Less is more. You're doing awesome. You're on testosterone, just on 200 a week. I mean, can you believe it? Can you imagine how many guys? There's tens and millions of you guys. I love you guys. So I don't want you to have any health consequences, brother. You're 50. I'm 62. You got to understand, you have to look at your A, B, cardiac, a calcium score, synergy, this is real synergy. I mean, like, this is like real karma synergy. It's been a long day, man. I need some coffee. Where's my coffee? Guys, sir, you need to know your ABCDs. A1C, B is blood pressure, C is cholesterol, cardiac. Did you get a calcium score? Get inside this health portal and let us work with you and tell you how to do it. Labs with no doctor's prescription, cheap with no insurance, bulk numbers, panels just for you, Testosteronology health portal. So that's your synergy, sir. Come on. 62. I am showing off a little bit, right? But don't you want to be like me? You know what my most important feature is? My heart and my kidneys. And that's why I'm so strong and I feel so good. And my sex function is like a goddamn 20-year-old, which is a problem. It's actually a problem because my health, your heart and your kidneys make great sex. Everything else, you're getting misinformation, guys. It's all wrong information as far as when you're getting older. Okay. So, sir, you are super impressive. You want to hold on. When at 50, even 40, you start dodging bullets, right? Cancers, heart, strokes, you motor vehicle accidents, depression, murders. I don't know. I mean, I can only do what I can do, sir. I could lead you to the water. I want you to drink, a horsey. Come on, horsey, have a drink. A, B, that's your synergy. So, I think synergy. He wants me like, can you add like a little Anavar, a little Primo, certain peptides? Yeah, man. I don't know. What do you want to do, bro? How about you keep it simple and you don't ever worry about having a heart attack, and you get older and you're just a beast, and your brain is great and your sex is great. And if I'm gambling, you're married and maybe you have a few kids, you can be an old dad like me. I still got my hand on that kid's neck. My kid just loves it. He's like, Dad, you're going to be 90 and still be able to beat me up. He's like, that's going to be great. I'm like, you damn right, son. It's great, man. Let's go. Next question. Synergy. Lovely. Doc, will high doses of fish oil help cholesterol? Oh, my God. I just read about this the other day. My LDL spikes. TRT, thank you. Dude, great question. Go to data. Go to a good data bank. The only fish oil that is legitimately proven to protect against people that have heart disease, it's called the Reduce It trial. Guys, Reduce It. Capitals R-E, reduce hyphen it. It's eicosapentaenoic acid, Vascepa. These are people that had significant disease. It was a secondary trial. They were on maximally top, they were on the medicines. Like they had some elevated triglycerides, but they weren't over 500. And they double blinded and they gave him unbelievable outcome. I love eicosapentaenoic acid. The data has shown up. This is controversial to some guys. You're going to this is why I have to have guns on me, because I say stuff and they get so angry at me because they're like, that's not true. But hold on. If you believe really good medicine with randomized controlled trials, there's been a lot of them with fish oils. None of these have ever shown to truly protect the heart. You're getting misinformation. And funny enough, sadly enough, paradoxically enough, those fish oils can be rancid. I want you to check that. And you're getting increased oxidation in your system. So my opinion, the only fish oil that is top in the real world of science, and very wealthy people are all on this, it's eicosapentaenoic acid, otherwise known as Vascepa, Vascepa. And I ain't selling for that company. But if you're a smart guy, young guys are really smart. Seems like the older guys are not that smart. I'm like, sir, you're old. You have all the money. But you don't want to take these medicines. The young guys are smart. They're going to live a long time. But they're listening to real technology. So when you guys fact check that, you're going to go, whoa. So EPA derived without DHE, that's where the money is. Sole EPA. Don't take, sir, your LDL potentially as high as you said. I want you to understand, what are your do you have atherosclerosis? Do you have family history? What's your LDL? What's your A1C? What's your blood pressure? How do the kidneys look? Do you have LP little a? It's all in the health portal. This is real stuff. Any doctor that's following, I know you're like, rock on, Dr. O'Connor. Thank you so much, brother, sister. Thank you. I'm going to turn this shit around for this misinformation. Next question. Sir, be careful with the rancid fish oil. No data. Does the at-home test you can buy to test to see if steroids are? Yes, there are some. And I'm working with Dr. Timothy Pitowski. Go on Google, Dr. Timothy Pitowski, anabolic steroid expert, PhD. Follow him on Instagram. Australia is way ahead of us with steroid checking. He has like open public places where you could bring your steroids in and they get them checked. I'm embarrassed that we don't have it in America. I'm working on it, guys. I'm going to work on it. Okay. So yes. Is it Roid? I think it's called Roid test. I'm not sure. That's Bill Llewellyn, and I've heard it was good. I really, this is a great question, but really those testing kits, the good ones that are really like the forensic testing, which is real, like forensic level, like in like the FBI lab and stuff. Like they're really out there. And the guy, and the Dr. Patowski, who I work with, we're doing research in Australia, Dr. Timothy Piatowski, anabolic steroid. Okay. I co-publish articles with him. He's a beast. And what a great doctor. Really harm reduction, trying to help people. We're very progressive. We're out there now. We're traditional doctors in the traditional medical world at all the universities, and we're belling up to the bar. They're tolerating us. The old guys are going away. Go away, old man. Go away, crunchy old damn man. We're coming up, man. This is real. This is like, people need to understand this and be safe. So yes, those tests, I just don't know which ones are great. There's Roid test with Bill Llewellyn. I heard it was good, but I'm kind of out of the loop on that. Apart from real steroid testing sites, we don't have them in America. I got to get them here. Mark, put it on the list. Put it on the list. We got to get that done. Steve, put it on the list. All right, guys, next question. That's a good question. It's a good academic question. I'm going to go for about another 15 minutes until I cave over, until I start stuttering. Herd, test, and mast is fountain of youth. God, hold on. Let me think about that. Test and mast. Is it a fountain of youth? Not really, but it's a great combination for guys. It's well tolerated typically, and can make you really horny, right? Because it's like going to increase, right, your free testosterone and all this kind of stuff, and Masteron, right? So look, Masteron, it's going to block the estrogen theoretically, right? We can go into a rabbit hole on that. Primobolan does too, but they're all similar drugs, guys. I know that, but they're hard to get. You can't get Masteron here in America. You can't get Primobolan. And what's going on with the last year and a half where the supply of Masteron and Primobolan, supposedly out of Asia, is completely shut down? Wow. Unbelievable. I think we need to have steroids, legitimate steroids like Primo, and we already have some Anavar here. I'm all good with that, but that's already here. And but I think we need to have some legitimate anabolic steroids that have a history of safety, like Masteron. But we need to have them above board, where, like cannabis, you can go to a cannabis facility. I'm going to get it going, guys, and you can get real steroids. Come on, I mean, versus like alcohol and drugs and overeating, a little bit of steroids. There's no way there's no way. Right. So I agree with that. But it is changing. And even like, if you look at the politics, we have politicians like RFK. If you don't like him or you love him or you hate him, like, he's on testosterone. He does pull-ups. I mean, like, he's older. He's 10 years older than me. And like, you can't agree. You can't, like, the guy's a beast. It's kind of cringy when he talks a little bit sometimes, but it is what it is. I think he's doing the best he can, but the guy's a beast. And I'm not saying he's on steroids, but he does say he's on testosterone and some peptides. That's in our government now. How is it going to be the next 10, 20 years? I mean, imagine we're going to have all politicians are going to be. Imagine Trump was on full-blown trend. It would be World War. We'd be done. The atomic bomb would be off already. I mean, thank God Trump doesn't take Trent. All right, guys, let's keep going. Next question. Mark, I thought you were going to laugh on the Trump with Trent. I look over at Mark and he's laughing. Thank you so much, Doc. Getting on the portal and upload all the, dude, get on it, bro. Inform the blood work I can. Going to get more blood work, including more iron studies in a few weeks before my next cycle. Rock on, Doc. Dude, you are awesome. So here's the deal. Go to the ABCDs. Don't get intimidated, dude. You're a smart man. Break it down, easy as she goes, plug and chug, and then use your Ask the Doc. And I'm going to answer all your questions with some of my top testosteronologists, the chosen ones. And we're going to give you all your videos just for you. And I'm not going to know, I don't know who you are. I saw the name there, but I don't want to see it though. And we're just going to give you your information, and you're going to learn piece by piece. And I've been doing this for 5. We had open live Ask the Docs like this, where it was wild and crazy, but it just got so out of hand. So I had to convert it over to where you have your own portfolio in the membership, and then you're organized with your ABCDs, and then you ask questions. You get your lab, get the labs all on the portal if you want, or get your own labs. You don't need a doctor to get labs anymore. You don't need a prescription in America to get labs. People don't know that. Get your labs. Figure out your ABC. I will walk you through. This is all I want to do. I want to spread it. And this is the beginning. The technology we've developed in there with AI, where we have 700 plus videos that I've made. They're not the ones on YouTube, right? They're specialized videos. We actually brought a few in from YouTube, but most of the videos on there are videos because YouTube has been censoring the shit out of me and taking me down. You know, I have a huge YouTube channel, 270,000, and I'm shadow banned. I should have millions. But you know, they got to keep the anabolic doc down. That's okay. So what did I do? I built my own. It wasn't easy to do. This is the 5th year. This is a big operation. But thank you so much, brother, because I'm autonomous in here and ain't no one shutting me down. And I'm ethical and I'm here to help you. You make your own decisions. I'm going to show you what it is and I'm going to tell you and guide you. There's nothing wrong with that. So don't get intimidated when you get in there and you look. Start with the ABCDs. Start with A, B, understand it. And then very soon we are hooking up telemedicine where you can get all your medications straight through the health portal. Yeah, telmisartan, nebivolol in America, right? Telmisartan, nebivolol. You can get good statins a little bit. Don't hate on the statins. You need a little bit of them. Okay. Pleiotrophically. Trust me. You want to protect your heart. Let me help you. And then, sir, get a calcium score. And if you got a few extra bucks and you're like over 30 or 40 around there, do a CT angio from Clearly. Give me the report and I'll read it for you. And I'll tell you, I have billionaires that I take care of, that I help with this. This is what I do in my day job. I'm scaling it for you guys. And then you can understand, do you need Repatha? Do you need Jardiance? And I'm going to do the best I can to get it for you from a good source as cheaply as I can't work. I'm trying to work with the big boys for all these. Where's my Repatha pen? Guys, you want to use technology. That's why my heart is so good. I just kept my mouth shut for years and years and years. And now it's all, no one could shut me down in here. They can't do it. And if they do, I'll move to the Cayman Islands. I'm not messing around, guys. We'll see you inside there, sir. Next question. I'm 26. I'm on testosterone 350 cruising. I'm on Cialis 5 milligrams. Rosuvastatin, a little statin baby. Nebivolol 5 telmisartan. You guys, this is my stack, bro. 40 milligrams. Cardiac markers are great. Can I stay on as long as my bloods are good? Can you imagine, guys? 26-year-old man. Sir, this is incredible. God bless you. So I don't want you cruising on that much. Look at this handsome guy, though. Still has great hair. I want you to, sir, why and I-A-Y? Maybe you're not an American. This is sounds like an Australian guy. Love you guys. Get in the app all over the world. Do your ABCDs. Take it easy. What are your eight? Let's bring the guy back up. Mark, let me just see something. Cardiac markers, sir. You're on Cialis, which is a nitric oxide doning PD5 inhibitor, right? For sex, right? Also for pulmonary hypertension, like sildenafil do you know that these drugs are IV sildenafil in the intensive care unit? I've prescribed them for pulmonary hypertension because they vasodilate. You're going to go well, I'm going to check that. That's crazy. Yeah. Look, so they're very good potentially, but there are some side effects, heartburn. Look how red I am all the time. And the veins are just crazy. But you know that. But you're on rosuvastatin and nebivolol telmisartan. So my ABCDs, blood pressure, right? So nebivolol, telmisartan. But so you're 26 and I wonder, are you hypertensive at 26? And from baseline, I would want to work. That's my first question for you when you come in the health portal. Are you hyper? I want a blood pressure. Here's the academic gold standard. We don't really care what your blood pressure is in the clinic anymore because it could be white coat, it could be mask hypertension. That's the reverse. It doesn't matter what you are when you're in there really. What is your blood pressure 24/7? And you know what the data shows? Get a home blood pressure cuff like Omron Platinum. Get a nice one, fits the arm, and check your blood pressure twice a day, 3 times a day. Do it for a week. I kind of get obsessive with it, right? You guys love the data. And then let's dial your blood pressure in. At your age, you have to be less than 120 and less than 80. And if you're on testosterone, my free test was 700 at one point, sexually 11, libido wasn't crazy, LOL. Only when I added the trend, my libido came in. Oh, it's incredible. I mean, trend is no joke, dude. Be careful with trend. I've seen a couple guys, however, very rarely, that have done trend, and the sex drive was so crazy on trend when they came off trend and they were still on tons of testosterone, they couldn't get their libido back. And I have guys all over the UK, and I worked with the medical system inside London, and they had some great. They were bringing the phone in. This is my doctor. This is like 10, 15 years ago when I was working in the streets, and I'm like talking to the guys in London, and they're like, "Yeah, Tom, we're trying. What should we do, Tom? I do this, do that, run that." It was sad. This guy ended up just saying goodbye to me, crying. He's depressed. He has, I think, depression, but did it have massive sexual dysfunction that never came back after he did trend for a long. Ooh, easy as she goes with trend. But again, you're young, 26, blood pressure. I want to see your blood pressure. Do you need that much? So the thing is, great question. Do you need to be on those medicines forever? How can I possibly know, sir? I need to see your medical issue. Do the medical questions in the great. But sir, get in the damn health portal and understand, let us help you bit by bit. ABCDs, understand it. It's guaranteed. If your ABCDs are perfect, there's nothing missed. This is go from head to toe. It's screening for all cancers that are appropriate for you based on the epidemiological public health. I mean, how can you argue this? But you have to plug and chug it. This health portal is not for someone who's lazy. If you're lazy, I'm not even working with lazy. If you're lazy, I've had some very wealthy guys, right? They're mostly very annoying. Okay. I'm not against capitalism. They're so fucking wealthy. They just pay the money and they think like we're going to like exercise their arms it's just like put an exoskeleton on. Let me just train you, sir. Let me punch you in the face, sir. You're annoying as fuck to me. Because it's like with all that money and like, I'm not doing this anymore for you. You're done. Goodbye. So it's like, you don't need that much money to get this damn health portal and figure out ABCDs. And some of these medicines could cost a few bucks, but if you put your head through it and you really work around it, my vital signs are that of a child's. And I'll show you my labs. You guys see my blood pressure. Imagine my crazy personality. I need blood pressure medicine. I need like darts in the ass for like a rhino. But I live this way, guys. Now, don't do what I do, but I'm living proof that you can do this and live a great life, have great sex. This is real anti-aging. Anti-aging is bullshit. Real health and understanding the vector forces, A1C, blood pressure, endothelial, cardiovascular, understanding the truth of lipids, your health history, what's in your coronary artery. Did you do a calcium score? The American College of Cardiology, American Heart Association, don't shit on those guys. They're the group that's who they are. Okay, they are the heart guys. They're the science guys. They're annoying, but they're not bullshit. Okay, and they're not selling stuff. I mean, they're just not. I know there's complicated relationships with industry. Please, if you look at the data, I'm an internist. Okay, this is real, magical, great science. They integrated this year the calcium score. This is falling on deaf ears. I know how to interpret all this because I've been doing it for years, and I'm a real internal medicine doctor, and I'm humble for that. I don't know everything, but I know this. I know A, B, and if I don't know something, I send you to a doctor that does, and I coordinate. I'm really a manager. Next question. Guys, get on the goddamn health portal and use it. What do we got, Mark?
Last one.
Oh, my Lord. I'm doing for 2 hours. Besides comprehensive blood panels, what test screenings are crucial before starting TRT? This is a great question, sir. So comprehensive blood panels, let's talk about it. Again, sir, let's go over the ABCDs. Again, I'm not kidding. Hemoglobin A1C. So if you're going to start testosterone, hopefully you need it. Again, this is apart from steroid guys. Those are my guys. Leave them alone. I'm going to help them. Leave my boys alone. They're starting testosterone. They definitely don't need it, but they're going to do it anyway. And they're not playing NFL. They're not playing MLB. I don't want to hear the cheating. And the enhanced games is a whole other animal. I don't want children on stage. That's going to enhance. That's going to provide potentially information and want children to do steroids like it's going today. I want to protect them somehow. If you're 21, 23, man, you're a fucking man, rock on. You can go to the war and kill yourself and kill people. That's your adult. Let's go. So you want to start testosterone the way my history and physical, it's inside this portal to train doctors and for members like you? Correct. Well, what are your medical issues? Do you have blood pressure, cholesterol? What is it? Have you looked inside your heart for a pre-existing diagnosis of atherosclerosis? Let's not wait for a heart attack or a stroke. What's your family history? Do you drink? Do you have depression and anxiety? I did. I still live on some medicines. I'm a real person. I'm not perfect. Be careful. If you start testosterone and you have an underlying history of depression or anxiety, it's tricky. I'm not saying it can't be great. I'm saying it's tricky. Okay? This is my real life. So, and then again, what medicines are you on? What are your allergies to medications? It's very simple. Chief complaint, history of present illness, the whole thing. I'm an old guy, right? So these are the Barbara Bates. This is like the med school, right? I was trained up in New York and Connecticut. I'm not sound arrogant, but I mean, come on, guys. It's really unbelievable. It was brutal, and I've never stopped, right? Never stopped. I live, sleep, eat, and shit this stuff, and I feel like I know nothing. I never forget as a intern and a resident, the older doctors said to me after 23, 24, 30 hours up, seeing bubbles and dots, thinking, I got to drive home. Holy shit. I better start doing, I better start snorting the cat. I've actually had like the cat taken out of the cafe, the coffee. Like I used to eat coffee with water down just to like get home. I'm not kidding. That was crazy because I wanted as much caffeine. And they were like, you going home, O'Connor? Shame on you, man. How much do you know? What'd you learn last night? And then you try to tell them and you're nervous and they're like, oh God, you're kind of pathetic right now. Why don't you just go home? And then you leave and you go into the garage, after the hospital, and you just have these feelings of euphoria, then dipping. And it's just like, wow, I know nothing. I learned nothing. And then you realize looking back year after year that you learned something. Okay, sir, you're going to understand medical history, your heart, your kidneys, your prostate. Testosterone doesn't cause prostate cancer, but if you have prostate cancer and you're older, because that's usually an older guy, right? If you're young, it's going to be rare. 40s, 50s, it's out there, but you better understand that. So these are all the tests are they're actually outside the app for free. They're actually outside. You don't have to be in the portal. I wanted people to access all the labs. So go to the health portal. I want you to be inside and to get the labs and understand how to use them in your ABCDs and ask a testosteronologist. However, you can go outside and just get these labs, but you're going to be winging it yourself. You have to understand, really, your medical issues, your heart, it's going to affect blood pressure. It's going to affect blood pressure. Do you just start? Look at these guys here. Look at these young guys here that are already starting prophylactic hypertension medicines. What do you think about that, guys? And is it unethical? Of course it's not. These guys are trying to block the effects, the adverse vector effects that the androgens can cause on the. What about not doing it, guys? Go away. It's not how it's going to be. Go away. Go to sleep. Go back to bed. Men have to understand, and women, these are effects of these drugs. You have to understand your underlying health first. That's what I'm here to help you with. There's no one better than me. That's what I do. Internal medicine, primary care, over 20 years. You understand your health and then your fingerprint based on the technology now. We can use this, we can use that. Don't do anything. Do DASH diet, DASH. Keep your blood pressure down. Cut down the sodium. Don't listen to these idiots that are out there. Oh my God, there's such bad information. And they're just young. They're yoked and young, and they have disease, but it's just silent. And they're just trying to make money. Okay, that's really, really bad karma. But they don't care. It's all about Lamborghinis and money. Boom, 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 boom. That's okay. It is what it is. So you come here because you want true medical information from the highest source. And you're going to understand exactly what labs to do, what medical information against or your heart, your kidney, your prostate, thyroid. These are all part of the differential diagnosis. And then you understand what to do moving forward, and then you monitor. So once you start testosterone, then you're monitoring. We have labs called on androgens monitoring, the red blood cells, right? And if you have a good history, a lot of these clinics just blah, 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 here you go. And then it's like they come to me because I'm the cleaner up. I'm the cleaner up. I was called the cleaner upper. Got to go to O'Connor. This is like over the last 20 years. I'm the end of the stage. I'm the end of the line, guys. You go to all these clinics, do all this and that, and things happen, and they come to me. I got to clean things up. Because once you're on testosterone long enough, you're not going to stop. And I'll protect you. Doctor, the guy, he doesn't need to take that much steroids anymore, but he's got to be on a little testosterone. Now people agree. But if you don't need testosterone and you're young, please don't take it until you need it. Testosterone's a light switch. It's either on or it's off. Don't do it. If you need it, you rock on and you come in and you have a testosteronologist. I'm done. 2 hours and 5 minutes. Whew. Love you guys all so much. So what's the Mark, flash up the because we have a half off. You guys, just for the people listening, we have a special offer today. 60%, guys. I thought it was 50%. Oh, God. Off the first month of Portal membership, $9.99. Use code LIVE999. And we're going to leave this open for a while for you guys. Hope you enjoyed it, all the work I'm doing for you guys. I am having a good time, so don't feel too bad for me. But everything's cool. You're not going to believe the technology. Now, in the next week or two, every week we're doing this. So keep coming back. Tell your friends, tell your family, tell your animals, all your pets have to come, and I'm going to answer. I'm also a pet psychic. Also come, and but now we're going to get my testosteronologists to start to feed in with their specialties. We have some nurse practitioners that are they're psychiatric nurse practitioners. I know nothing. I keep it from the chin down, guys. These guys are brilliant, legitimate, psychiatric licensed nurse practitioners, better than doctors. I didn't say that, did I? In this country that are autonomously functioning, and they know more than anyone on depression and anxiety and OCD and stress disorders, PTSD. You're going to see these guys. Jason Bennett, for an example, is unbelievable. And he's, unbelievable. Okay. And I've vetted these people very, very closely. So you'll see them on the health portal. If you like to consult with them, feel free. You don't even need to be a member inside the app, but these healthcare practitioners that I've developed and I've worked on for 2 years now with the training, they're open and ready, some of them, the chosen ones, to ask the testosteronologist because they're testosteronologists. They're licensed under me. So awesome, dude. You signed up. Whitway. Where are you from, brother? Thank you so much. Information. I have a lot to learn, consider before. Excellent. See this? This is a guy that's not on testosterone. And this is really the best stuff because he's not going on. He's going to get the best information, education, and make an informed decision. I love it, brother. But thanks for all information you're giving to everyone. Always great stuff to share. I wish I could spend an hour on the phone. Well, dude, get in the damn thing. And the best we can offer is you're going to ask questions and I'm going to answer it with my other test. Wait till you see the information in there. I got to go not have a drink. I love drinking, but I can't drink anymore. So I'm a real person, guys. I'm a real person. All right. Love you guys. I'll see you next week.